a tiny part of a virus, we cannot get sick from it. More traditional vaccines use weakened versions of the actual virus. This also triggers an immune response, but could also give you mild symptoms. Now you know how mRNA vaccines work, but don't take my word for it.
Okay, and so I thought that video would be a good introduction for us into how mRNA vaccines like the COVID-19 vaccine works. And it's gonna be important to keep in mind some of the important ideas or topics that that video brought up, such as the fact that when you get the COVID-19 mRNA vaccine, your body is able to produce antibodies that can fight against the COVID-19 virus when you're infected by it. And this is going to be important when we talk about boosters and why we need boosters. And so let's now discuss, what is a vaccine booster? And so a booster can sometimes be the exact replica or exact same initial vaccine that you get, or it can be tweaked. In the case of the COVID-19 booster, what they're able to do is that they can tweak the booster and design it so that it can target all the different variants of COVID-19 that are popping up, like the Omicron variant. And so a big benefit of getting the booster shot is that you're protected from all the different COVID-19 variants that are popping up and infecting people and causing severe disease in some cases. And so the Pfizer and Moderna vaccines can be changed easily as a booster to match the variants that are developing and protect us as they arise. And so it's also important for us to talk about why you would need to get a vaccine booster shot if you've already been vaccinated from COVID-19. That's often a common question I get where people sometimes ask me, they say, I got vaccinated against COVID-19. Why would I need to get a booster shot now? Shouldn't being vaccinated be enough? Well, that's why I mentioned it's important for us to keep in mind the idea of virus-fighting antibodies that develop once you get vaccinated from COVID. So immediately after you get vaccinated against COVID-19 with the COVID-19 vaccine, and this could be the Pfizer, the Moderna, or the Johnson & Johnson vaccine, your body develops high levels of virus-fighting antibodies. However, it's normal for your levels of these virus-fighting antibodies to decrease in your body as time goes on. And so an important benefit of the COVID-19 booster shot is that it increases or boosts the amount of virus-fighting antibodies that you have in your body to fight the COVID-19 virus, along with helping you protect you against all the different COVID-19 variants that are popping up, like the Omicron variant. And so it's also, I think, important for us to talk about, how do scientists know that the COVID-19 virus-fighting antibodies will decrease in your body over time, which is why people need boosters. So what scientists have done is that they've carried out these research studies, and what they've done is they've measured the antibody levels in people's blood after they've been vaccinated from COVID-19 to see how high the levels are of these virus-fighting antibodies as time goes by. And what they found is that the COVID-19 virus-fighting antibody levels in people's blood tends to decrease in vaccinated people after around 6 months, which is why it's recommended after a period of months pass by for people to get boosted so they could boost their virus-fighting antibody levels again. And so I'll pass it over to you, Natalia.
Thank you, Ashley. Okay, so now that we know what mRNA vaccines are, how they work, and how our body disposes of them, we can go ahead and answer the questions, why do I need a second booster? Isn't one enough? So you can go ahead and change the slide. So just like Ashley mentioned, COVID-19 booster shots are given to people in order to give their immune system a boost, just as it says in the booster, so that they are better protected from illnesses, in this case, protection from COVID-19. So then, who is eligible to receive their second booster shot? So at this moment, people who are 50 years or older, people who are moderately or severely immunocompromised. So an example would be individuals who have cancer and are going through chemotherapy, and people who have received 2 doses of the Johnson & Johnson vaccine, meaning 1 primary dose and then the booster dose, can now receive their second booster shot. And these populations can receive their second booster shot at least 4 months after receiving their first booster shot. Okay, next slide. Thank you. So because vaccines for these specific populations were given a while ago, the protection offered by the vaccine against COVID-19, as we have seen, has decreased. So getting a second dose will provide you with higher protection levels against COVID-19 once again, which is important given the rise in COVID cases due to the new Omicron variant, BA.2. And data shows a 78% lower mortality rate among individuals 50 years and older who have received a second booster dose compared to those who have only received 1. So as you can see, the levels of protection significantly increase with a second booster dose. Next slide. And on top of that, rates of serious disease among people who received a second booster dose were lower than those among people who only received 1 booster. So specifically among the eligible populations, those who only received 1 booster were 3.5 to 4.3 times more likely to fall seriously ill compared to those who have received a second booster. So next slide. So now that summertime is coming up, it is important to give your system a boost by getting a second booster so that we can continue engaging in these activities that include group settings such as concerts, festivals, parties, get-togethers, cookouts. I know there's a food festival coming up here in the city in July or June. So make sure to prepare for that by getting boosted. I know I personally wouldn't want to miss out on all the good food. Next slide. So aside from getting your booster, here are a few more things that we can do to avoid getting sick this summer. So number 1, make sure to wash your hands often with soap and water. And this is just a general protective measure for a lot of illnesses, not just COVID-19. Throughout the day, we're constantly touching different surfaces, and those surfaces are just full of bacteria. I don't know, you might pet a dog or a cat, you might shake somebody's hand, there's just bacteria everywhere. So it's important to wash your hands often or use hand sanitizer so that we can prevent getting ill. And number 2, wear a mask. Because COVID-19 cases are rising again due to the new variant, we do recommend the use of face masks if possible, especially if you're not eligible for a second booster yet, just to, again, offer more protection among these populations. And then 3, get vaccinated. Even if you're still not eligible to receive a second booster, it is important to stay up to date with your COVID-19 vaccines. So this means getting your first booster if you're eligible to, so that way we can all comfortably gather again for this year's big celebrations, not just for summertime activities. And then lastly, get tested. Again, as summer events are approaching us, it is important to get tested if you feel like you're coming down with something or if you've had contact with somebody with COVID. That way we can prevent spreading it to those who might be immunocompromised or have a weakened immune system. I know a lot of people want to have a pre-COVID summer once again, so we can all work towards that by taking care of ourselves and our bodies, which includes getting tested so that we can rest if, we're sick. Next slide. So if you're interested and eligible to receive your second booster shot, or if you're interested in getting your primary series or your first booster, here is a list of resources that you can use to schedule your appointment. And Stephanie will be adding these sources to the chat so you guys can access that and have more time to look at them. But the first one would be to set up your appointment at your previous location where you got your either primary series or your first booster. Or if you don't want to go to that location, you can always go to the website vaccines.gov or text your zip code to the number on the screen or call that number to find locations near you that are offering second booster doses. And if you are a patient of Heartland Health Centers and you need to get your COVID-19 booster dose, please call the number on the screen to make an appointment. Okay, and the next slide. And then if you're looking to get tested for COVID or simply would like testing resources for future references, here's also a list of resources that you can use. And Stephanie will also be adding these to the chat just in case you want to access that. But for beginners, we do have PCR testing for non-patients at Heartland Health Centers. And this is only at our Devon location on Wednesdays from 1 p.m. to 4 p.m. So you can call that number to make an appointment for Wednesday between 1 p.m. and 4 p.m. if you are not a patient of Heartland Health Centers. And the next slide. And if Heartland Health Centers is not for you, you're always welcome to order free tests, free at-home tests, and you can get a total of 8 tests per household. So 2 sets of 4 free tests. And there's also Walgreens. Again, Stephanie will put the link down there, but they have participating locations and they'll help you find a location near you that is offering testing and even vaccines as well. So if any of you guys would like these resources emailed to you, please enter your email in the chat so we can get that to you after the webinar. And I'll pass it down to Stephanie so she can open the floor for any questions.
Thank you, Natalia. I'd like to know, Star, if anybody in the meeting have any questions, feel free to speak out or to put it in the chat. Other questions? I have here a question that people ask a lot, and is, do we need a booster every 6 months then?
That's a great question, Stephanie. And I think the best answer for that question is, you know, since COVID-19 is such a new virus, you know, the government and all the like scientists and researchers are learning more about the virus as time goes by. And so the answer to your question is, you know, we're actually just waiting to hear more what the guidelines will be from those like researchers, from the government, from the scientists who are doing this like work and researching the COVID-19 virus. We have to see what their recommendations are based off of how we're doing as a country in protecting ourselves from the virus, or if any new variants develop or anything like that. And so the short answer to your question is the guidelines in terms of future boosters, it's kind of unknown a bit, you know, what the guidelines will be around future boosters. But what we do know now is that for those who are older than 50 years old, it's very beneficial for them to get a second booster shot now because they're more vulnerable for contracting severe disease if they get COVID. And so, you know, time will tell in the future how things will go. But for now, older than 50, we recommend you get your second booster shot.
Okay, great. Thank you. In the beginning, you play a video about how the vaccine goes into the cells. Mm. Does the vaccine interact with humans' DNA?
That's another great question, Stephanie. And the answer to that is that it doesn't. It doesn't interact with your DNA. It doesn't enter the nucleus of your cells in your body, which is where your DNA is. It stays outside of that part of your cell, and it just works to replicate that spike protein portion that I mentioned so that your body can develop those virus-fighting antibodies to protect you if you contract COVID-19 in the future. So no interaction with your DNA whatsoever.
So that's great, because I know from the community, women that are pregnant sometimes get worried about the babies and how, mostly now that we have to be getting like now 3 vaccines, right, for people under 50. So if that affects the babies?
No, the vaccine does not affect the baby in any negative way. In fact, it's very beneficial for the baby because when you as the mom can develop antibodies, some of those antibodies, when you develop antibodies as the mom that will fight COVID-19, some of those antibodies will be transferred to your baby. So by getting vaccinated as a pregnant woman, you're actually helping to provide your baby with some COVID-19 virus fighting antibodies to protect your baby if they were to get infected. So you're actually helping and doing the best for your baby if you were to get vaccinated while pregnant.
Great. I have a question. It was mentioned that we have to get tests if I'm feeling sick. How often do I need to get tested? And how do I know? Like sometimes I might have sore throat. Like how do I know? Do I have to get in test every time that I feel a symptom?
That's another great question. And I think that really falls on the person and the availability of tests. And so if you're feeling ill and you maybe live with someone at home who's immunocompromised, who you're worried might contract the virus or get COVID-19, or if you are around people who are older and you don't want them to get sick and you want to be safe, it's always a good idea to try to test yourself whenever you're feeling unwell. Because the truth of the matter is, even if you may not be heavily impacted by COVID-19, if you get infected, you might infect others, and that might cause them to get very ill. So in the interest of protecting everyone around you, if you are feeling ill, the best thing to do is to go ahead and try to get tested if you can. If you can find a site, like you mentioned, like Heartland Health Centers that you can go to and get tested, go do it. If you can get access to an at-home test to test yourself at home, you can go ahead and do that. But the best thing that we can do to protect ourselves and others is when we're feeling ill, try to get tested. If you're not able to, that's fine too, but I would say try.
Okay, thank you. One last question, and this is very common from the community. So we mentioned that we have to get tested so I don't infect others, but so why do I get the two vaccines and now a booster and older than people a second booster? Like how that happen? If I'm getting the vaccine, how I'm going to infect others?
Right. That's another great question. And so, and the answer to that question is when you get vaccinated, you can protect yourself from getting either when you get vaccinated or boosted, you can protect yourself from contracting a severe form of COVID-19 or getting very ill and ending up in the hospital. But you can, but even though you yourself is protected by the vaccine or the booster, you can still contract COVID-19 and pass it on to others who may not be vaccinated or who may be immunocompromised or may be very old, or they may have a lot of comorbid conditions like obesity, high blood pressure, that puts them at a higher risk of getting very sick if they were to get COVID-19. And so although the vaccine and the booster may protect you, you can still catch the virus and pass it on to others who may not be so protected as you. So that's why it's important to still get boosted, to still get vaccinated, to still get tested, even if you're feeling a little ill, not very ill.
Okay, those are the questions I have, questions that I heard from the community. I don't know if anybody in the meeting would like to ask a question or any comment. If not, we are about to end. And I would like the people who is with us in this meeting to answer some questions that I think, it's a little feedback. So I would appreciate that. If no, this is our webinar, and thank you so much for your feedback, and I hope we see you soon. Bye, thank you.
Thank you, guys.
Bye, everyone. Thank you for coming.
Kiss me.